Hi guys, it's Stephanie. Welcome back to my channel. If you're new here, I'm an internal medicine doctor in Canada, and I'm about to start another 15-hour night shift. So one of the things that's new that's happened in the last couple weeks during the coronavirus is that I actually have to fill out a questionnaire before entering the hospital. So this is a questionnaire that includes information about whether or not I have symptoms, any shortness of breath or cough, as well as if I've been in contact with anyone who may have symptoms outside of my patients. So I'm going to fill out that questionnaire now and then head on into the hospital. So I passed the inspection and now we're just heading up to the office where I always hang out before my shift officially starts.
No.
Hey guys, so I just got a consult about a patient who had a fall and what they think may be a syncopal episode. So I'm gonna go down and see her and then we'll talk about her later. Let's go. Hey guys, so I've just finished admitting a whole bunch of patients. I did want to talk about one in particular, which was an 85-year-old man who was found on the ground with what we call a syncopal episode. And syncope is basically a transient loss of consciousness, or in other words, a fainting episode. So whenever someone comes in with syncope, we want to figure out the actual cause of why he had this episode. And a lot of this can actually be elicited from the history that you take from the patient. So I'm going to go over an acronym that will help point you in the right direction of the actual cause to the syncopal episode. So there's an acronym that I use, and it's actually the word syncope, except for the Y is actually a V because they kind of look the same, but we'll get to that. So the S stands for situational. So you really want to elicit what was the situation surrounding the patient that caused the event, or what happened when they had the fainting episode. So were they going to the washroom? So a lot of elderly people actually have syncopal episodes when they're straining to go to the bathroom, and it can cause their pressures to change, and basically you'll get the history that they actually fell off the toilet because they fainted while on it while going to the washroom. You want to ask them basically what were they doing during that time. The next letter is not a Y, it's a V, and that stands for vasovagal. So vasovagal means that there's a specific stimulus that actually causes you to feel faint. So have you ever felt lightheaded or sweating, or if you've had a fainting episode, had these symptoms where maybe your heart was racing a bit and you felt nauseous, and there may have been a stimulating event such as fear, or maybe you were anxious, or some type of stressor, or the heat. Were you standing in line and it was a very hot day? This is a specific stress that can lead to a vasovagal episode, and it usually has that typical pre-syncopal symptoms that I mentioned before you actually fall. To digress a little, I once had a syncopal episode in an OR as a medical student. It was very embarrassing. It's definitely not my highlight of my medical career, but as someone who really never fainted in their life, I was not a fainter. My sister was a fainter, but I never fainted, and I actually prided myself on the fact that I never fainted until this one night where I was on call during general surgery, and we had a case that didn't come in till 4 in the morning, and I was very tired and very dehydrated because honestly, when I'm on call, I don't tend to drink too much, and actually that just reminds me I have my water here that I'm going to try and drink because I'm already dehydrated. And anyways, I was standing and we're doing a cholecystectomy, which is basically a laparoscopic procedure. So you don't even open the patient up. So there's very little blood. There's literally a TV screen. I'm holding the camera because as a medical student, you don't really have your job is not very important half the time. But I was holding the camera and I started to feel unwell. I was feeling nauseous and sweaty, and I felt like almost this buzzing in my head, and because I knew the symptoms, I was able to tell my staff that I think I'm going to faint. And so I stepped away, kind of sat down, and had like a mini fainting episode in the OR on the floor. Definitely not my finest moment. I was actually quite embarrassed after. So that is what I would call a vasovagal syncopal episode, likely from dehydration and possibly stress of being up all night. I'm definitely used to that now because I can be up all night like a freaking boss. And the next letter is N, and that stands for neurogenic. And neurogenic is usually when a patient presents with a stroke. So whenever someone comes in and they've been found on the ground, we do usually CAT scan their head because we want to make sure that they don't have a stroke. So anyone who's had a stroke or a TIA, which is a transient ischemic event, that can actually cause a syncopal episode. Next is cardiogenic. So cardiogenic is basically if there is an abnormal problem with the heart. Basically if there is a structural problem or a rhythm problem with the heart. When there's a structural problem, there may be some abnormalities in the valves. So something called aortic stenosis, where there's a narrowing of the valve. This can lead to someone to have a syncopal episode. If they have a rhythm problem, so if you see, the ECG up and down, if there's a long pause, that can lead someone to pass out. Or if it goes into a scary rhythm such as ventricular tachycardia or asystole, these are very scary rhythms that can actually cause sudden cardiac death. That can lead to a syncopal episode. So cardiac is important because they don't always have any symptoms. They may just drop and they don't feel lightheaded. They may not even have chest pain. They may not have anything. And when a patient comes in with that presentation, that's worrisome because it could mean it's a cardiac cause to this problem. So the next one is orthostatic. So orthostatic hypotension is basically when your blood pressure drops when you stand from a seated position or from a lying down position. So there's something called the 30-20-10 rule. And so what you notice is when a patient gets up from a seated position or a lying down position to seated and to standing, you want to check their heart rate, their blood pressure at those times. You have to wait 2 minutes in between so the body can acclimatize. If their heart rate goes up by more than 30 beats per minute, or if their systolic blood pressure, which is the top number, goes down by more than 20, or if their diastolic blood pressure, which is the bottom number, goes down by 10 millimeter mercury, then this is something called orthostatic hypotension. And a lot of people may have it. You may have felt, I know I have felt lightheaded when I get up too quickly. And because you're healthy and maybe you're younger, you're able to not faint. And your body is still able to adjust to the change in their blood pressure and heart rate. Elderly people, not so much. Usually we treat this with first non-medicine things such as making sure they're not dehydrated, maybe making sure that they have compression stockings on, or they get up slowly from a seated position. And that's what we always tell patients, before you get out of bed, sit on the edge of the bed, wait for a little bit, then start your day. If that doesn't work, then we may have to give medication. So that's orthostatic. Next, there is psychogenic. So sometimes people have panic attacks or anxiety, and that can induce a syncopal episode. And then finally, the E stands for everything else or endocrine. Endocrine means checking their actual sugar level. So if a patient comes in with a low sugar, either if they're diabetic and they took their insulin but maybe didn't eat enough, and their sugars are less than 4, that can be very dangerous because there's not enough glucose going to their brain, and their brain's like, I can't take it anymore, I need to have a syncopal fainting episode. And sometimes the only treatment for that is to actually give them sugar. So that can be very dangerous and very scary, but it's something you don't want to miss, and you want to ask that patient, especially if they have diabetes. So with this patient that I had, I really talked to him about these symptoms. He was found alone on the ground. His family found him a few minutes later, so it's really unsure of the exact time that he was out for, but he wasn't in the washroom, he was just in his bedroom. He really wasn't able to tell me if he felt any symptoms prior to falling. So he didn't feel that he had any sweating or chest pain or lightheadedness. He really didn't have any symptoms. And so, like I said earlier, that kind of concerns you for cardiogenic causes. So what I'm doing for him is that I'm admitting him to the hospital. I'm going to put him on a monitor, which is a telemetry monitor, to make sure that he doesn't have any abnormal rhythms. So we'll look at his heart rate all night long to see if there's anything abnormal about it. I'm ordering him an echocardiogram, which is an ultrasound of the heart to look at the structure of the heart to see again if there's any abnormalities in the structure, in the valves that could have led to this episode. I'm asking for orthostatic vitals in the morning, not now because it's late in the middle of the night, but in the morning. When they do his vitals in the morning, they'll check his blood pressure and his heart rate to see if that was the cause. And then I'm also going to get some blood work because I want to make sure that his electrolytes are good. His glucose level was good when he came in, so I'm not too worried about that, but some baseline blood work for him to see if there was anything else that I'm missing. So that's basically syncope in a nutshell. Most of the other patients I've had so far, not too much exciting. A couple infections. I did have a COVID positive patient, but now it's becoming old news, honestly. But she's doing okay. I'm gonna see if we can get some rest now. Well guys, I am back home. It is almost 8 o'clock. I'm starting to feel quite tired now, so I think I'm gonna head into bed soon. I really hope you guys enjoyed this vlog and learned something from it. Please comment down below what you'd like to see from me in the future, as well as if you have any other medical questions. And of course, like, subscribe to my channel, and I'll see you on the next one. Everyone, stay healthy, be happy. See you later.